And maybe explain why many of my patients, and I think many people out there, although they may know about this, they're not actually carrying through with the advice of this activity to change the brain processes, of reducing the limbic system's sympathetic drive, which is driving pain and the stimulus for pain down the autonomic nervous system fibers from the brain down to the body, causing constriction or tightness around the soft tissues and the nerves that make the nerves super sensitive and painful. And this is not a conscious event, this is an unconscious event. 24/7, signals are going from the brain to the body, and then the body sending the signal back to the brain saying, hey, we've got a problem, it's called pain. And therefore the brain in its dysfunctional state is causing the loop to continue with more signals down, causing constriction and tightness and more pain. So how can we change the brain to change our pain? So Jamie Pennebaker is the world authority on this subject, and he started his research about 40 years ago now, and he's in Austin, Texas. And I had the privilege of interviewing Jamie for my podcast show, and we had a wonderful chat. And I've also gone through one of his workbooks called Writing to Heal, which is recommended. It's about $80, but it's worth its weight in gold because it gives you not only the background to why this works with the top guy in the world with his research, but also exercises. And I strongly encourage you, if you're interested in taking this to the next level, to get this book. And he has other books as well. So look up his name, James. He likes to be called Jamie, but officially it's James Pennebaker, so Pennebaker. Now the reality is, our society is not doing much writing these days. You know, we've got our phones, we've got our iPads, we've got our computers, and we're all typing. We're all going like this, you know, through the day. And we've lost the art, or at least the desire to write. And I think that's why people are not doing it when they know they maybe should, or they've been encouraged to do it. So my question to you tonight, you've heard this podcast show, you've heard this message several times if you're a regular. Are you writing? And if not, why not? If you are, fantastic. And if you are, I encourage you to do a little bit more. You know, I'm going to share a story of a patient who I know fairly well, known her for several years. She's been coming to me for trigger point injections and cognitive behavioral therapy and advice on nutrition. And she's in her 60s, and she has been told about writing for a long time. And she shared a story with me several weeks ago that literally blew me away. She says, you know, I was really down, I was depressed, the pain was severe, and I sat down and wrote for hours. And she poured her heart out onto that paper. And she went from a state of depression and desperateness to almost ecstasy, in the point that she was just so relieved that she got some of the stuff in her heart out onto paper. Not too sure if she ripped it up or she kept it safe, but she spent a long time writing. And I would encourage you to do that. If you're really low, write and write and write and write until you can't write anymore, and just see what happens inside of you. It is a cathartic experience if you put your heart and soul into this activity. And I strongly recommend at least once a week that you write for maybe an hour. You know, set the time down and just write and write and write and connect with this lost art. You know, one tip is get a place that you love. Maybe it's a quiet room in the house. Maybe there's soft lighting. Maybe there's a candle there. Maybe there's some music in the background that you can put on. Maybe there's a nice warm blanket to wear if the room is a bit cool, or put on a thick sweater. Find it and make it special. Maybe go outside, go to a coffee shop if that's what you like, and write there. Just spend a time and spend in a place where it's a good vibe, it's a good feeling, and that will certainly help you want to write. So that's the advice tonight. Get your paper and pen out, or a pad and paper. You know, I do get asked, like, should I keep it? Should I rip it up and send it away to the garbage? I quite like the write and rip approach because it's all out, and it's, you know, it's between you and the paper, and it goes in the garbage. Nobody's going to read it. And I think people are scared of what maybe their loved one would find if they wrote and therefore they don't want to keep it. But that's a personal choice. But remember, you're writing for you, not for anybody else. So if you want to keep it safe in a location, then that's fine too. But the key is to write. So I'd like your feedback, please, on this subject. Are you writing? If you are, how's it going? If you're not, why not? What do you think about tonight's advice of just putting your heart and soul into this activity? So I do look forward to see what you've got to say. So I'm going to bow out now, as always, and I look forward to next week. So thanks so much. It's been good talking. I look forward to it next time. Bye.